Hello friends, welcome back to AIAPGET and UPSC revision series by Friend of Health. Through this series, we are trying to share our notes and important points and revision points from various study materials for AIAPGET and UPSC, and also various other competitive examinations like lecturer post PSC of various states and other state PSC for medical officer recruitment. So today it is a special episode on genetic disorders. This is a part 1 and episode 3 of the revision series, and there will be a part 2 about the genetic disorders. So watch this video fully, so that in between the slides we will be explaining the important points or the repeatedly asked areas from each disorders. First one, cystic fibrosis. So if you see the pathogenesis or heredity, it is an autosomal recessive disease. So many a times this itself is a question. Cystic fibrosis is autosomal recessive. And what happens there? The pathogenesis. CFTR gene defect on chromosome 7. No chloride transport and failure to hydrate mucus secretions. So excessively viscous mucoid exocrine secretions. If you know the pathogenesis properly, many a times in UPSC pattern questions, there won't be a direct question. There can be 4 points and you have to choose 1 or 2 among them. So option will be like A and B, B and C, C and D, or A, B, C, D, like that. So you should know the concept behind the question fully. So here once again, pathogenesis of cystic fibrosis is CFTR gene defect on chromosome 7, no chloride transport and failure to hydrate mucus secretions, excessively viscous mucoid exocrine secretions. So cystic fibrosis, a very important question. Keep it in mind. So we will see the cardinal symptoms or the pathology. So here, meconium ileus caused by thick mucoid meconium. That is one pathology of cystic fibrosis or cardinal symptom or presentation. Respiratory bronchiectasis, Pseudomonas pneumonia, pancreatic insufficiency. Then one very important question, you can see hypertonic high chlorine concentration, that is hypertonic sweat or high chlorine concentration in sweat. This is very repeatedly asked question about the cystic fibrosis, high chlorine concentration in sweat. So this you have to remember from the cardinal symptoms. Even other are very important, because you can expect whenever there is a golden rule of MCQ making. Whenever there are 1, 2, 3, 4, 5 or more than 3 or more than 4 examples, you have to expect a question like all of the below except, like that. So go through these slides once again, make your own notes and do the revision. So this is one important one, hypertonic chlorine sweat or high chlorine concentration in sweat. Other than that, everything is important. So we'll move on to the next condition. The second one, very important, Fanconi anemia. So in Fanconi anemia, if you see pathogenesis or heredity, it is autosomal recessive and congenital pancytopenia. There will be congenital pancytopenia. Every count like the WBC, the RBC and the platelets, everything will be less. So pancytopenia, if you want to know more about the disease, if it is not like a revision, if you have not gone through this, if you have time you can go through this, because in UPSC we can expect a question from genetic disorders. So if you are seriously preparing for UPSC, you can go through the conditions in detail. Otherwise you do for revision, these notes will be more than enough. So congenital pancytopenia and Fanconi anemia, we'll see the principal or cardinal symptoms and pathology. So nomocytic anemia with neutropenia. So again penia, you can see here nomocytic anemia with neutropenia. So you need to know every presentation in detail and properly, so that a question comes in an application level like a case format also you can answer. So short stature, microcephaly, hypogenitalism, strabismus, anomalies of the thumbs, radii and kidneys, mental retardation and microphthalmia, and nomocytic anemia with neutropenia. This is all about Fanconi anemia. Now we will see the third one, Hartnup's disease. So in Hartnup's disease, pathogenesis or heredity is autosomal recessive again, and defect in gastrointestinal uptake of neutral amino acids. So Hartnup's disease, keep it in mind, the defect in gastrointestinal uptake of neutral amino acids, malabsorption of tryptophan, niacin precursor, and niacin deficiency, among other things. So this is like a the presentation will be like a niacin deficiency presentation. So you can see Hartnup's disease in the presentation or the pathology or cardinal symptoms. Pellagra-like syndrome, diarrhea, dementia, dermatitis. So you should know that the presentation of pellagra is diarrhea, dementia, and dermatitis. And Hartnup's disease also, you can see the pellagra-like syndrome, diarrhea, dementia, dermatitis presentation will be there. Light sensitive skin rash, temporary cerebellar ataxia. So these are the very, very important points about Hartnup's disease. And the fourth one, Kartagener syndrome. Kartagener syndrome is a very, very repeatedly asked question. Pathogenesis or heredity is autosomal recessive, and defect in dyne arms. So defect in the dyne arms and lost motility of cilia. This is the basic thing you need to understand. Lost motility of cilia in Kartagener syndrome, and defect is in the dyne arms. So this is a very, very important question. So many question papers you can see this Kartagener syndrome. And the pathology or cardinal symptoms are recurrent sinopulmonary infections. Due to impaired ciliary tract. So once you know the pathogenesis, you can correlate with the symptoms and the presentations. So the cardinal symptoms include pulmonary sinus or sinopulmonary infections and situs inversus due to impaired ciliary motion during embryogenesis. This pathogenesis makes a presentation of situs inversus, and lateral transposition of lungs. Abdominal and thoracic viscera are on opposite sides of the body as normal. So these are the presentations. So situs inversus will be there, and possible dextrocardia, male sterility. So again, a cause of male sterility, Kartagener syndrome. So the fifth one, hereditary spherocytosis. When you speak about hereditary spherocytosis, many questions you can see in the previous UPSC and the major examination, competitive examinations of homeopathy like MD entrance examinations and state PSC examinations. So pathogenesis or heredity is again the very important hereditary spherocytosis. This itself is a question. Autosomal dominant, and band 3 deficiency in RBC. Membrane will be there. Spherical shape to cells. So the normal cells of RBC you have to know. So that is in the physiology. Normal is discoid, you know that, biconcave discoid shape. And here the cells will be spherical shape to cells. So hereditary spherocytosis is very, very important. And cardinal symptoms or the presentation, the pathology, sequestration of spherocytes in the spleen will happen, and it lead to hemolytic anemia. Sequestration of spherocytes in spleen and hemolytic anemia. Sixth one is Huntington's disease. So Huntington's disease heredity is, you can see a very, very important point. Autosomal dominant and 100% or complete penetrance you can see here. This is a genetic disorders we are dealing with. All these terms, the penetrance, the autosomal dominant, the heredity, everything you should know what are the basics. And if you know that, once it is very clear, you can correlate with the conditions and you can study. So Huntington's disease, autosomal dominant and 100% penetrance. Genetic defect on the chromosome number 4. So wherever chromosome numbers are mentioned, you can note down all those in a table, and you can revise it very frequently. Maybe like once in 3 days or once in 4 days, you need to make a habit of repeating the this kind of things, the numbers, the years, maybe in the number of things or the years, the measurements. You can write down in a small notebook, and you can revise them, and you can make it by heart, so that you will not miss such questions. So chromosome number 4, here you can see Huntington's disease. Some mnemonic, your own mnemonic you can make, otherwise you can repeatedly revise and you can remember. So genetic defect on the chromosome number 4, Huntington's disease, and what happens is atrophy of caudate nuclei, putamen and frontal cortex will happen here. So Huntington's disease, the presentation, the pathology or cardinal symptoms is progressive dementia with onset in adulthood. Coriform movements, athetosis, these are the cardinal symptoms. So progressive dementia with onset in adulthood. So maybe a case will be presented. You can get a practical level question, like application level question, a case of progressive dementia which was started in the adulthood, and coriform movements and athetosis are the presentation. You can diagnose it using your knowledge, Huntington's disease. So these are the things you should know in this disease. And the seventh one, Marfan syndrome. Pathogenesis or heredity is autosomal dominant, and fibrillin deficiency will be there, and faulty scaffolding in connective tissue. Elastin has no anchor. Fibrillin deficiency and faulty scaffolding in connective tissue. Elastin has no anchor. Marfan syndrome, if you see the cardinal symptoms or the pathology, arachnodactyly, this is very important, arachnodactyly, and dissecting aortic aneurysms, ectopia lens, there is subluxation of the lens will happen, and mitral valve prolapse. So Marfan syndrome, you should be very thorough about the cardinal symptoms of the Marfan syndrome: arachnodactyly, dissecting aortic aneurysms, ectopia lentis. So this itself is a repeatedly asked question, and mitral valve prolapse. So here again 1, 2, 3, 4 things are there. You can expect a question like all the below are the symptoms or the presentation or cardinal symptoms of Marfan syndrome, except so one among these may be changed to maybe mitral valve prolapse. Instead of that, any other cardiac lesion will be given. So these are the very common cardinal symptoms. So we'll be very thorough about it. Eighth one is neurofibromatosis, von Recklinghausen disease. Again, pathogenesis is autosomal dominant and NF1 gene defect, no GTPase protein. So this is the pathogenesis, and what happens is dysregulation of RAS tumor suppressor protein. So again, this itself is a question. In neurofibromatosis, what happens? The defect is in the NF1 gene, and no GTPase protein will be there. Dysregulation of RAS tumor suppressor protein, and it is a very repeatedly asked question, neurofibromatosis. And you can see the symptoms are very important. Multiple neurofibromas, Café-Late spots. So Café-Late spots is a very repeatedly asked question. It is associated with neurofibromatosis. Café-Late spots, which may become malignant. Lish nodules, pigmented hematomas of the iris, and increased risk for tumors. So NF or neurofibromatosis is like always having an increased risk for tumor, pheochromocytoma, Wilms tumor, and rhabdomyosarcoma leukemias. So this you should keep in mind and revise these topics very frequently. Ninth one is tuberous sclerosis. So pathogenesis is autosomal dominant. So tuberous sclerosis, keep it in mind, autosomal dominant, and you should know the cardinal symptoms: tubers or glial nodules, seizures, mental retardation associated with adenoma sebaceum, facial lesion, and myocardial rhabdomyomas, renal angiomyolipomas. So tubers or glial nodules, seizures, mental retardation are the cardinal symptoms, and associated with adenoma sebaceum or adenoma sebaceum, facial lesions, and myocardial rhabdomyomas, renal angiomyolipomas. Angelman syndrome. So in Angelman syndrome, pathogenesis or heredity, if you see deletion of part of short arm of chromosome 15, again a number, chromosome 15 defect. So deletion of part of short arm chromosome 15, maternal copy, and this is an example of genomic imprinting. So among the genetic disorders, some interesting things will come. Angelman syndrome and its presentation, the cardinal symptoms are very interesting. So an example of genomic imprinting is Angelman syndrome. And the pathology or cardinal symptoms, if you see, mental retardation, ataxic gait, seizures, and an interesting symptom, inappropriate laughter. So if you see the facial expression of Angelman syndrome patients or the babies, they will be always happy or in a happy mood, or inappropriate laughter will be there in their face. So mental retardation, ataxic gait, seizures, inappropriate laughter are the presentations. So this will be continued with a part 2, and thank you for watching. We would like to know your feedback about this series, and watch our old series and make your own notes, and do multiple revisions before the exam. And all the best for your UPSC and AIAPGET and lecturer post examinations which are on the way. And stay tuned with Friend of Health. Share these videos with your friends and study groups, and watch more of our videos, and give your valuable support with comments and suggestions. Thank you for watching.